We're going to talk about flaccid dysarthria and show you some different tasks, evaluation tasks, and some treatment options. Flaccid dysarthria is caused by impairments to lower motor neurons and cranial or spinal nerves, damage to the PNS. It's characterized by slow labored articulation, imprecise consonants, hypernasality, and hoarse, breathy voice quality. Conditions that can damage lower motor neurons include physical trauma, brain stroke, myasthenia gravis, and polio. Other causes include tumors, muscular dystrophy, progressive bulbar palsy, viral or bacterial infections. Alright, we're going to demonstrate some key evaluation tasks. She'll be the patient, I'm going to be the clinician. The first one we're going to do is conversational speech and reading. These can evoke errors of resonance, articulation, respiration, and prosody. So conversational speech would be if we were just having a conversation and I would be recording her so that later I could go back and look at it and analyze the different errors that she was making. But reading, I'm going to have her read some pages out of this book. It's simple, no big deal. We'll see how she does.
I didn't like the school in Winter Hill. In Winter Hill they laughed at me. Elizabeth laughed most of all. I never raised my hand to answer a question, but when Miss Stickley called on me, I had to say something. My English wasn't perfect yet, so Elizabeth always giggled at whatever I said. Miss Stickley would stare up at her, and then she'd shut up. But later, in the schoolyard, she'd say, "You talk funny, Molly. You look funny, Molly." And then she'd sing a song.
Good enough. You get the idea. The next one is alternate motion rate, or AMR task, and it'll highlight a slowed rate of speech. So what I'm going to have you do is I'm going to have you repeat puddika,
Puddika.
and I'm going to have you do it as fast as you can. So like this, puddika, 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 until I say stop. I'm going to time you. Okay. Ready? Go.
Puddika, 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 puddika.
You can go ahead and stop. You get the idea. The next thing we would do is the prolonged vowel, and that can highlight a number of different errors. So I'm going to have you say ah, and I want you to hold it as long as you can. So take a deep breath and then hold it as long as you can. Go. Ah. Okay, great. I was timing her. That's what that means. The next one is a speech stress test to check for myasthenia gravis to see if she can be worn out and then recover quickly. So I'm going to have you count from normally 1 to 100, but I'm just going to have you do 1 to 10 to demonstrate. So whenever you're ready.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good job. I would have her usually do to 100 so that it really wears her out and to see what her recovery period was. All right.
Okay.
Now we're going to do
Treatment. I will be talking about the treatment of flaccid dysarthria. The general rule to follow for improving speech production is to focus solely on speech production. And first I'm going to talk about the resonance deficits with flaccid dysarthria, and this is caused by damage to the vagus nerve. The first two options are surgical procedures. The first one is a pharyngeal flap procedure, where a flap of tissue from the pharynx is surgically attached to the velum. The next one is a Teflon injection, where Teflon is injected to a point in the pharynx and it creates a bulge in the pharynx that reduces the distance that the velum must travel to make closure. The next option is a prosthetic treatment, which is a palatal lift, and it's essentially a dental retainer with a rear extension that helps elevate the palate during speech, or the velum during speech. The next treatment area, which is debated, there's not a whole lot of evidence to support it, is velar strengthening and non-speech exercises. It's shown to work on a small number of patients. The continuous positive airway pressure has been shown to work on patients with dysarthria. The next area I'm going to talk about is modification of speech. Some patients have been able to minimize their resonance by modifying their speech. The ways they do this are reducing the rate of speech, speaking with a more open mouth position, and also increasing loudness. And next I will be talking about the treatments for phonation in flaccid dysarthria. And Sarah is going to be my patient. The first way that we can treat phonation would be to do pushing and pulling exercises. And these exercises help the vocal folds gain a more complete adduction. So what we're going to do is Sarah is going to be producing a prolonged vowel, and she's going to first pull up on her chair while she's saying ah. So I'd like you to do this. Ah. Go ahead. Ah. And as she pulls up, that pressure is causing her vocal folds to adduct more tightly and increase intensity. And the other way to do it would be to push down on the chair rather than pull up. So, very good. The next thing that helps improve phonation is simply holding your breath. This requires the patient to be able to fully adduct the vocal folds, and we would like the patient to hold their breath for about 15 seconds in 10 consecutive trials. So I'm going to have Sarah hold her breath, and I'm going to time her. So go ahead and go. Very good. Let go. And for the sake of time, we're not going to do the other 9 trials. The next way to improve phonation is to begin each utterance with a hard glottal attack. So this could be a cough, but what we're going to do is Sarah's going to take a deep breath, bear down, and attempt to phonate a tight ah. So, ah, ah. Very good. The last way to treat phonation is head turning and sideways pressure on the larynx. With some patients, they're able to gain a tighter adduction by turning their head towards the affected side or by pressure on the larynx. So you would just turn your head to the left and then phonate ah. Ah. Or also I could add pressure. Ah. Very good.
The next area we're going to talk about is treatment for prosody, and the first one is pitch range exercises, which will actually begin with pitch perception, and then once that's mastered, we'll go to pitch production. So the clinician should first model, and then the client can imitate. So what I want you to do is copy what I do for this pitch range exercise. You start at the very bottom, and then you go up to the top like a siren. Oh!
Okay.
Good. And the next way is an intonation profile, which is you use lines to show the intonation for that sentence. So I wrote a couple sentences, and I want you to read where the intonation is for that meaning.
Okay, so for store. Billy went to the store.
Good. And then the second sentence.
For Billy. Okay. Billy went to the store.
Good job. And the third way is a contrastive stress drill, which is when the clinician asks a question to the client, and the client answers in a way that shows the intended meaning. For example, you like your coffee hot?
No, I like it cold.
Very good. And the last way is chucking utterances into syntactic units, and this helps the client know when to inhale naturally within the sentence. So I wrote a sentence here, and I put slashes to show the client where to breathe.
Okay. I went to the store to buy bread, cheese, milk, and eggs. Then I baked a cake.
Very good. The next thing we're going to talk about is damage to the facial nerve and the hypoglossal nerve. And you can treat that by articulation tasks. And the first one is intelligibility drills. And you give the client a list of words, and she reads the words, and the clinician turns to see if she can understand all the words that are being read.
So I'll turn. Okay. Ready?
Ready.
Toothbrush.
Toothbrush.
Baseball.
Baseball.
Cowboy.
Cowboy.
Hot dog.
Hot dog.
Ball cap.
Ball cap. That was good. And the next way is phonetic placement, and that's when before the client would produce a phoneme, you would first show her where the placement should be before the production takes place. And the next one is exaggerating consonants. For example, if I ask Ambia to say the word cat, you would need to exaggerate the K, A, and T, like this. K, A, T. So you try.
Okay. At.
Very good. And the last one is a minimal contrast drill. So, for example, I'm going to use the words pat and bat, and she would just need to be able to distinguish between the two words for pat and bat.
Pat and bat.
Good job. The next part is treatment for respiratory weakness, and there are 4 tasks for that. And you just want to check for correct posture, sitting up straight. Good. And then a compensatory prosthetic device, which would be an abdominal girdle, but you wouldn't want to wear that all the time because it could cause pneumonia since your lungs aren't able to inflate as much as they should. And then the last 2 go hand in hand, and it's speaking on exhalation and then cueing for complete inhalation. So Ambia, I'm going to have you inhale, and then as soon as you start to exhale, I want you to say, "My name is Ambia."
Okay. My name is Ambia.
Very good. And the last one's cueing for complete inhalation. So she's going to take a deep breath, and I'm going to say, "Okay, that's good." Good.
Okay.
So, for the summary for treatment of flaccid dysarthria, you can attempt to strengthen weakened muscles, but you want to directly increase intelligibility of the patient's speech.